Welcome back to part 2 of the evolving role of social media in radiology. And we asked the question last time, can social media expand our clinical practices and our academic potential? And I think when you look at all of the things that social media can do, of course, the answer is yes. As we mentioned last time, it's really a matter of you choosing what areas you want to start with. If you have done little with social media, to say, I'm going to do all these things at one time is probably a recipe for failure. Start with one thing. Maybe it's with the patients. Maybe it's with your own staff. Maybe it's with referring physicians. And again, social media is already impacting your practice, whether you like it or not. I mentioned before things that are available to you from radiologyinfo.org, but every single day, whether it's from Mayo Clinic or Cleveland Clinic or you name it, there's information that each of your patients is seeing, whether it's on Yahoo, whether it's on Google. Everybody is seeing information, whether it's ChatGPT. Everyone is seeing lots of information. So in some sense, it's important for you to make sure that your conversation with your patients is a good one. There's a thing called Yelp. Yelp is a thing where you go to a restaurant, you say, oh, the restaurant was great, the restaurant sucked, the hotel was great, the hotel sucked, whatever it is. But many of you don't know this, but the patients are actually using Yelp to identify your practice, good or bad. And there was an article by Doshi a couple of years ago talking about the number of comments, either pertaining to the radiologist or the service or the site itself, that were both good but often not so good. And not a surprise, but patients' perception of radiology is largely shaped by aspects of service quality. Schedules, receptionists, technologists, billers heavily influence patient satisfaction in radiology. It's good that you can read the film well, but if the techs are nasty, if the front desk is nasty, if you can't park, if you can't schedule, if you can't get a report, if you can't get a disc, you're going to get really bad ratings. Now, here's just a customer review. Now, okay, you think Yelp is going to talk about, who does your lawn or who does your siding or anything else, but I put in Yelp CT scan in Baltimore. It listed a lot of different places from urgent care to different groups. I mean, I don't see a good grade amongst any of them. And then I'm afraid to look at this Hopkins thing. My CT scan reading was incorrect. I heard the staff talk more about TikTok than about... Now, that's not our staff. I don't know what they were talking about. Plus, they can't hear the text anyway. But the point of the matter is, look at those ratings. Oh, my God. And then here's another one. I looked at CT scans again. Or here, looking for radiologists. Hey, we got a 4. The other guy's got a 3 or a 2.5. Again, what are people talking about? Now, sometimes people just complain, to be fair. They'll complain about the best restaurant. They'll complain about Adele in concert. They'll complain about anything. But it's good to perhaps look and see, is there anything at all that you can fix? Maybe it was the parking. Maybe the signage is no good. It's a whole lot of things that you could look at, perhaps, that could be helpful. Now, here's an article by Rosenkrantz talking again about in AJR. The fact is that we really don't know it, but patients are rating us. Okay? Online social media provides a platform for women to share their experience and reactions in undergoing mammography, which includes humor, positive reflections, and encourages others to undergo the exam. That's a great thing. However, people also complain about the roughness of the exam, the long wait time, and the callbacks. You can see, look at the things patients spoke about. Breast compression, waiting for results, generalized apprehension regarding the exam. Again, good and bad. These are patients. There's a range of patients, a range of fears, a range of knowledge, a range of histories. We need to get in front of this and make sure that everyone everywhere has a good experience. And I think the web can really help us do that. There was this article also in AJR talking about what happens if they search your name. What do they see? It's not like Elliot Fishman puts up an ad and I control it. I guess if you go to PubMed, you can search my articles, but I don't control what's up there. And so when I go to Google, and I just typed in the other day, you can see all the different things that Google has, and it goes on for thousands of pages. Look, 1.6 million results. That's pretty good, but you can see what the patients will see and what they can read about. They also can look at where you stand in terms of publications, what you've written, what's your rating. They can look at your H-index. Not that they know what that is, but you can find out a lot about people just by typing in a couple words. Just remember that. Now, in terms of radiologist to radiologist and radiologist to trainee, I think the social media, the aspects of education are indeed so strong. Article this past month by Ziba and Owen. The power of social media really lies in cultivating a sense of excitement and learning, which can inspire learners to engage in lifelong learning in a fun, interactive manner. Social media platforms provide students the opportunity to think critically about educational topics and enjoy learning with the added value of collaborative engagement. What could sound better than that? Practice testing involves participating in multiple assessment activities to reinforce learning, and distributed practice involves studying in multiple short sessions instead of one long session. Again, combining the most effective learning strategies of practice testing and distributed practice with the most influential social media platforms can be a game changer in medical education and learning. Again, very, very positive. Participating in social media-based quizzes and assessing instant feedback can make this type of learning highly productive. Gaming increases engagement. Instant feedback provides a crucial role in learning. All of the things that social media platforms can do are what people have spoken about for years as being very important in learning and teaching. And as Ziba says, a learner can leverage social media to watch a YouTube video on a topic, then view and learn a different topic by reviewing a case presentation on Twitter, all within a short period of time. The learning style also taps into the different methods of learning, namely auditory, visual, and kinesthetic. This learning strategy of distributed and interleaved practice provides real-world context to learning. And again, you as the learner decide whether you want to look at cases, whether you want to hear lectures, whether you want to quiz yourself. You control the motion. And this article, published in Academic Radiology, really makes the point that education and social media are closely tied together. And whether it's in the U.S. or worldwide, this is where things are going. Now let me show you a little bit specifics. I'll take CTisus. This was a couple weeks ago. And you can see number of weekly visitors. Those are different visitors. And where they come from. We typically have over 200 different countries. The U.S. is number one. We have rearranged the website, new protocols, different ways of doing things. We're constantly changing to meet the needs of our users. But there it is, lectures, quizzes, pearls, text, articles, summaries, you name it, everything you could want. You can go in, you can look at learning modules, pick a topic, cardiac or GU. You can go into learning modules and find PowerPoint presentations, audio presentations, anything you would really like to look at. We have monthly quizzes, which we then post them all together. So we have thousands of cases. In pancreas, is about 250 cases. We see a case, you pick an answer, and then that case is discussed with a 1-minute discussion. Again, quizzing yourself and listening to discussion. Even if you get the answer right or wrong, that may not be as important as how you were thinking. And this way you can listen to how an expert is thinking. We have tons of material. Pearls are interesting things, roughly 100 to 150 pearls, which are tidbits from articles in the past month, really help you see what's going on in radiology. The best articles on CT are posted, so a good link to see what's going on. We now have a big session on deep learning and AI because we're doing lots of that, and it's going to impact all of us. Everything and much more is there. Our teaching file is now over 301,000 images, which probably translates to 60 or 70,000 cases, divided into about 20 topics from GU to liver to OB and the like. You can look at these and take it as a quiz. You can look at these with just the answer. It links to references. It links to pearls if you want to see them. And again, you could touch one image, it blows it up, and then you scroll through all the other images to reach the right diagnosis. Sometimes we have as little as 4 images. Probably we average about 10. So we're trying to do that. We're on Facebook. In that week, we have over 250,000 followers. This post had almost 20,000 reach. No, actually 65,000 reach this week. So very, very important to be looking at Facebook. Here's some of the things we'll show on Facebook. We'll show cases, we'll show quizzes, we'll show references, we'll show articles, and the like. And again, you can see how important it is. We posted this, and within just hours, 27,593 people looked at this. Okay? It's unbelievable, the reach and the views of what people can do. And whether it's medical art or whether it's looking at our top posts. Look at our top post. This is a 1-month period. 47,000 in this case of fibrous dysplasia. Okay, just amazing numbers. You used to be happy you spoke to a lecture of a few hundred people, or you gave the opening session in RSNA and spoke to a few thousand people. Now we're talking about 50,000 people. It's amazing what you can do with social media. And again, here's just the post from the prior day. Within a day, 3,000 reach, engagements, on and on. Some of these posts were only up there for an hour. And then we could look at our summary. Yes, we do look at numbers, not that we're selling anything and not that we're charging anything, but we want to make sure we're doing the right thing. We're trying to figure out, what do people like? Is it pictures? Is it video? Is it a combination? We want to make sure whatever we provide is what people want to see. So if you're going to do social media, try to get as much feedback as you can, and many of the websites provide it. We also look at where our people come from. Not a surprise, the age of our users on Facebook and Instagram is a younger population, 25 to 34, though it goes 65 plus. But it means that a lot of residents and junior faculty and fellows are looking at the website, and that's no surprise. And then maybe it's a surprise where people come from. Remember, 80% of Facebook users are non-USA. And look at our top countries. India is number 1, then the US. Look at those countries. Again, both for Instagram and Facebook, India is number 1, both above the US. A lot of physicians and people in training in India, and we do thank all our friends in India because it's one of our big areas of following. And then you look at things like cities. Again, look at those cities. I have not visited any of those cities. And I surely haven't visited Tehran, but Tehran is our number 1 place in Instagram. No wonder we get so many emails from people in Tehran. So again, places that perhaps have less formal education processes, people of interested in learning are going to the web to get all the information. And again, we do things like lectures. Every week on Thursday, both on YouTube and on Facebook, I do a lecture. Once a month it has slides because it's a quiz. The rest of the time is me talking about a topic. Last week was social media. A couple of weeks before it was on colon cancer and screening for colon cancer. So again, it's very, very important to think about how you can reach patients and how you can reach your colleagues. Again, it does take work. I will not... I need to be clear, I guess, that it's not just you press a button and everything happens. There's no expense to get Facebook, but there is expense for people to help you, people work with you, people to build the sites, and people to help run the sites. It's not as simple, perhaps, as I make it, but it is doable. And Facebook Live we love. It's an easy to use, easy to access online resource for live interactive educational delivery. There's no prep. I can give a talk right now. I press the button, hit Facebook Live, boom, I'm live, and I can start talking. And you could watch it live or you could watch it later on. Probably 90% of our users, or 95%, both on YouTube and Facebook, will watch things later on. And again, you could choose the topic. We ask people what topics they want. We look at things that are popular in the press. We look at popular articles that have come out, things that relate to the disease of the month, like colon cancer month was in March, things like that. There's no right and there's no wrong answer of what topics to discuss. And here it is, me on Facebook Live. And you can see here, 15,394 people reached with 3,700 views. Again, Facebook Live typically runs about 10 minutes. I'm trying not to make it too long or too short. Lily made the point that in Facebook Live, we've looked at trying to figure out what people like, what people don't like. Quizzes people do like, so we do them once a month. We show the cases, people can think about them, then I discuss them. We then also talk about topics of interest. I don't use PowerPoint slides for those lectures. I just speak to you, whether it's on the adrenal or preventing misdiagnosis. It's a chat. It's a fireside chat between you and me. And if you want to show up, you can ask questions, and I'll answer those questions as well. So again, how we use things like Facebook Live is really dependent on what our users want to see. Facebook Live gets better and better. It makes it easier to use. But again, key thing is topics, and make sure the topics are what your community wants to see. I've mentioned several times that social media allows us to redefine who we are and the role radiology plays in healthcare. We can provide all of this information. Now, we do our information for other radiologists, for other healthcare professionals, technologists, med students, residents. You can, of course, develop your websites for patients. The content is different. The imaging is different. So know what audience you want to reach. I mentioned we use Instagram, 134,000 followers, looking at images, looking at some short videos. It's an incredible, intuitive, and easy-to-use platform. However, it's important to post quality images rather than quantity. Very, very important. And this was Serena Schaefer wrote this article about 5 years ago. And Instagram is something that we continue to see growth on. It's used by many different sites for medical education. Children's Hospital Cincinnati has used Instagram to teach pediatric radiology to other medical professionals. It's a very easy site to use, and it's become more flexible because now you could do video and audio. Before, you only could use still images. And you can see here's just a simple post. You can see we've done 2,700 posts and 134,000 followers. So it's pretty good. And here's just some of the screenshots, some of the posts. You can do Reels now with your video, and I won't go into that. But as I mentioned, Instagram also allows videos. So a very, very important platform. Instagram has a much younger population who uses it, and that's why it's so strong with medical students, radiology residents, fellows, and junior faculty. We spent some time and published this article looking at what works best on Instagram. And again, we looked at videos, which were up to a minute long. We looked at pictures, and it seemed that people who use Instagram really liked images. Now, maybe that's a convenience factor. Maybe it's the factor that that's how Instagram was born, that if you really want to look at videos, you're probably going to YouTube. But again, I think it's important to read these articles, figure out where different websites work, what social media platforms work best for the type of material you want to do. And again, here is a point about from Sayez making the point that they were a small hospital, they started it, And then from there, it became bigger, and different organizations in the country use it. And you can see it's not just a US-based platform. YouTube, long lectures, short lectures, quizzes, vignettes, whatever you want to put on there. That's what we use YouTube for. 37,000 plus followers, and it constantly is growing. As we mentioned in our recent article, it's the most popular social media platform for radiology education. Okay? And that's not based on what we think, that's based on what the users told us. And again, you can see here, look at YouTube in terms of responses. Facebook is up there, Instagram is number 2, Facebook was 3, but YouTube was clearly number 1, and Twitter was a distant 4th. And again, just look at some of those numbers. So it becomes very, very important to us. How do you rate the usefulness of social media in radiology education? You can see 34% said extremely helpful, 40% very useful. So over 75% felt it was very useful. There was only a small percent of people who felt it wasn't useful. So that tells you a lot about where social media is in terms of education. Now, we looked at YouTube very carefully. Again, it varies in terms of usability and content. What do people really want? And you know what I'll do? I have a bunch of things I want to comment about YouTube, and we're running a little bit late on part 2. Let's do this. Let's come back, do our final part, which is part 3, starting off talking about YouTube. And I'll be right back. If you like this video, make sure to subscribe to the CTisus YouTube channel. You can also visit us at ctisus.com for even more videos, plus quizzes, pearls, protocols, and oh so much more. We're also in the App Store and have well over a dozen apps for iPhone and iPad, all completely free. Thanks for watching.